wow, wow, wow. I am absolutely honored and humbled. I have so many thank yous. Thank you to Vikas. Thank you to the Lown Institute, the incredible staff at the Lown Institute, the Lown family who I've had the privilege of meeting over the last few days, to all those who are part of this nomination and selection process. Thank you, thank you, thank you. This is such an incredible honor. Happy 101st birthday to Dr. Lown. I love birthdays. So, you know, in some ways as a pediatrician, it's kind of my job to make sure that kids have as many good birthdays as possible. So much of my job as a pediatrician is making sure like kids are healthy today, like we treat them for their sniffles and their broken bones. But really my job as a pediatrician is about making sure that kids have even better tomorrows, that they can have as many of those good birthdays to come, from like vaccines to, you know, injury prevention and, you know, wear a car seat and eat healthy. It's all about the tomorrows, the more good birthdays that we can have for our kids. I'll tell you a quick story. I was in clinic a couple weeks ago, and one of my favorite questions I love to ask children is, what do you want to be when you grow up? And I had a little girl come in for her 4-year checkup, and I asked her, I'm like, what do you want to be when you grow up? And she looked at me and she said, I want to be 5 when I grow up. That was awesome. And I want her to be 5, and I want her to be 6 and 7 and 8 and get up to 99 and beyond and have amazing birthdays. But as Vikas shared in Flint, there was something in our water that was kind of threatening the tomorrows, the birthdays of an entire population of children. So, you know, one day I was a pediatrician taking care of one cute kid after another, asking lots of kids what they want to be when they grow up, giving out fist bumps and high fives and stickers. And the next day I was kind of facing the dire needs of an entire population of children, because with every baby bottle, every sippy cup, every glass of water, my kids, my Flint kids were being poisoned by their drinking water. And I had a choice to make. Would I keep my eyes closed and go about my busy business? And I was busy. I was a pediatrician, a professor, a residency director, a mom, a wife, juggling a million balls in the air, just like so many folks do every day. Or would I stand up and do something? And there really was no choice. From the moment of knowing about the possibility of lead in the water, there was no unknowing it. It was a choiceless choice. I could only go forward because there was too much at stake. It was about my kids and their birthdays. But making others see was a whole other thing. I ran up against people and entire systems that were built not to see, even when they did know that there was a problem. And it was almost like this indifference, this willful blindness to certain people and places and problems. And no matter how scary and how hard it seemed, I couldn't close my eyes. And that makes me think about Dr. Lown and all the amazing things that he did in his life, because throughout his life, he couldn't close his eyes to injustices that were threatening the health of not just his patients, but of people everywhere. He saw a problem and he couldn't unsee that problem. It was only about going forward, finding a solution with science and also with stubbornness. And I've got to hear more firsthand about his stubbornness. And I love that because I'm absolutely stubborn. And I leaned into that single-minded kind of science and that stubbornness. And my doctor role quickly shifted from clinician educator to detective scientist to patient advocate. And even as I offered up that scientific proof that yes, lead, a poison, was increasingly in the bodies of our children, my research was met with denials and attacks. For a quick minute, you know, I regretted using my voice. I was scared. I felt defeated and tiny. I began to second guess myself. After all, I was just one person, you know, one doctor, a small, you can hardly tell, I'm like barely 5 foot tall, a small brown immigrant woman going against really powerful forces. And I thought to myself, Maybe I should have just stayed in my lane. It would have been easier to keep my eyes closed and my voice silent. But I quickly realized this wasn't about me at all. This was about my kids, right? My kids and their birthdays. Whether we knew it or not when we started, by taking on a life in medicine, we have placed ourselves on the front lines of some of the most important battlegrounds of society. And Dr. Lown knew this. Our work is about standing on those front lines every single day, against sickness and disease, but also holding those lines against injustice and apathy. And sometimes that means being on guard for a city that's being poisoned. And sometimes that means holding the hand of an isolated COVID patient whose life is slipping away. Sometimes that means, late nights in the lab trying to figure out how to prevent sudden cardiac death. And sometimes that means trying to stop nuclear warfare. Dr. Lown understood that our work is about people. It's not about the power or the prestige or the paycheck. It is about people, the people that we are privileged to serve. He also understood that our work is not restricted to the bedside nor the bench. It's not just about providing direct patient care to the people in front of us, but it's also about seeing beyond the obvious and addressing what truly makes our patients healthy. And I think what Dr. Lown understood the most was that for those of us in medicine, we kind of have a superpower. Our voices are powerful, they're privileged, and they're credible. When we speak grounded in what's best for our patients, people listen. I walked out of my clinic and my MD behind my name was a megaphone for the kids of Flint. And I used it, and I was loud, and I was stubborn and persistent. And it was the voice of medicine that ultimately changed the trajectory of an entire city. And I haven't let go of that microphone, and I'm going to hold on to it as long as I can to help as many kids as I can, because it's not just about Flint. There are kids and communities everywhere poisoned by inequities. And while I have this microphone a little longer, I just want to share that this incredible honor is not so much about me, and it's not so much about Dr. Lown either, but really it's about you. It's about all of us, and it's about who we want to be. Our collective work is unfinished. We have a lot of health injustices, a lot of big problems that still need solving. We need you. Big things like eliminating poverty and eradicating racism, narrowing inequality, reversing the climate crisis, preserving our fragile democracy, ensuring healthcare for all, protecting women's reproductive health right now, and ending gun violence. These are all things that are making our patients and our communities sick. These are some of those upstream threats, those root causes that are making people sick. And rather than making the right diagnoses, we too often reactively Band-Aid. And our communities cannot afford to have the guardians of health, those of us in healthcare, shut their eyes, look away, and stay silent to injustices that threaten the health of our patients. And I know all this sounds kind of overwhelming, and I want to share something that Dr. Lown said. He said, "Great as the present danger is, far greater is the opportunity." My story is about turning a crisis into an opportunity. It's about wielding that superpower that we all have in medicine to walk outside of our hospital and university doors, to challenge the status quo, and to make a difference in the world. And it's happening everywhere. I see it happening everywhere. Every day I am inspired by folks in medicine bravely facing their present dangers, big and small. And we heard about all the amazing other folks that were nominated, all these people, all over hundreds of them, doing amazing things, turning these present dangers into opportunities, opening their eyes to the inequities that are all around us, inequities that make our patients and communities sick, and standing up bravely for justice and opportunity and democracy and equality. I think Dr. Lown would be proud. There are hundreds of people deserving of this award. I know this award will continue into perpetuity because there are so many amazing folks doing amazing things. But we need hundreds more. Imagine a movement of doctors and nurses and all our partners in healthcare united for structural change. So as we celebrate Dr. Lown's birthday and this humbling, incredible recognition, I hope it all leaves us inspired and committed to a tomorrow that is healthier, more equitable, and more just. And a tomorrow with more kids in more places celebrating more birthdays. Thank you so much. Thank you so much.